I'm Jackie. I'm a pelvic floor physical therapist, and I help mamas prepare for birth and have a smooth postpartum recovery. This birth prep routine is going to help get mobility into the pelvis and increase your hip mobility so that you can get into great positions while you're laboring, both in early and active labor. First, starting on hands and knees, we're going to go into a cat-cow. Start with an inhale as you lift your head up and your sacrum rocks forward. Then you're going to exhale as you push through your hands, tuck your tailbone under, and mobilize your spine. Keep going back and forth slowly to mobilize into your upper back, middle back, lower back, all the way into your sacrum. Inhale, head up, belly falls towards the ground. Exhale, push away from the ground, head comes down, sacrum tucks under. Next, we're going to add a yoga block to this movement so that you can see the asymmetry of the hips and the pelvis and how that feels a little bit different. Switching the hips back and forth is going to be really important for both early and active labor to help baby descend down into the pelvis. I'm going to start by putting my yoga block under one knee, and the rest of the movement is exactly the same, but you'll notice that this hip is going to be a little bit higher than the other. This motion can be great for also relieving tailbone and low back pain later in pregnancy. Inhaling and exhaling. And then switch sides. Inhale. Exhale. Doing about 10 to 15 each side. Now we're going to move the yoga block back over to the other side for a different type of hip switch. This is also going to help to stabilize your pelvis for any of those aches and pains later in pregnancy. Putting that yoga block under the right leg, you'll see that there's this asymmetry in the position of the hips, and you're going to lift that other knee to meet the level of your knee that's on the yoga block. Inhale down, exhale, lift. Inhale down, exhale, lift. This is also working into controlled rotation, so it's going to be working this glute here while also mobilizing the pelvis into asymmetrical rotational movements. Switching sides. Inhale, prepare. Exhale. Lifting just to the level of that other knee. Also notice that you're keeping somewhat of a neutral spine through this exercise. Besides the rotation, you're not coming into a cat or a cow position with this. Now we're going to take the block and put it underneath your bottom. I like to do it on this medium height here, but you can also sit on it on the highest height like this. And you'll just adjust it to get it to the right position there. And then I am in a deep squat position. I've got my elbows pushing my knees out, my hands together. And I'm just going to breathe here, thinking about descending my breath into my pelvic floor. When we're using this deep yogi squat to prepare for birth, we're getting the knees into external rotation at the hip. So we are opening the top of that pelvis, which is really important for helping baby to descend down into the pelvis in those early parts of labor. You can add rotation to this motion by doing a little bit of this, open, and rotate back down, meeting the other hand, open, meet the other hand, breathing throughout. It's really important to get the upper back mobile during pregnancy because it affects the position of our diaphragm, which actually also directly impacts the position of the pelvis and the pelvic floor. Having a mobile back also helps us to be more effective with our breath. We need to have a mobile upper spine for the rib cage to expand when we are breathing into our lungs. We need the lungs to be able to expand, but for that to happen, the rib cage and the spine need to be able to expand as well. Now we're going to go into a rock back position, starting back on all fours. Inhale, keep your spine neutral as you send your sit bones back towards the wall. Exhale, come back up. Inhale, hinge at the hip. Coming all the way back to your heels. Exhale, come back up. Inhale, exhale. So in this position, I have my knees about hip width distance, but now I'm going to spread my knees a little wider to open that top of the pelvis. And then I'm going to rock back onto my heels and come back forward. Rock back, come forward, rock back, and come forward. And now we need to internally rotate the hips because that part helps to open the bottom of the pelvis, which we will definitely need later in labor as baby descends down, and we need to open the bottom of the pelvis. So I'm putting my ankles out and my knees in, and you will probably not be able to get as far. You're keeping your spine neutral here and sending your hip bones back, mobilizing into internal rotation at the hip. This is also a really nice stretch to that posterior pelvic floor if you're keeping your pelvis and spine neutral. Next, we're going to switch our hips back and forth. This is going to also keep working on that hip mobility, which is going to help your pelvis open as you're entering the different stages of labor. These exercises are really important for mobility. They also are going to help you figure out what positions are comfortable and tune in and connect with your body so that when you are in your labor positions, you can figure out what positions work best for you. And you can really tune in to, okay, I think I need to flip my hips this way to make more room in this side of the pelvis. Switching back and forth, breathing, getting some good mobility into the hips. And that is our basic birth prep routine. I hope you enjoy. Let me know if you need any more help with that in the comments.